Hi, everybody. Thank you for joining us. Hi, Jackie and Maria and Pam and Annette. I feel like it's so fun. I feel like I know you guys already. Morgan, Kat, I see you all the time. Thank you for coming. Jennifer, Roshi, I see you, Roshi, Amy. Thank you guys for coming. We really, really appreciate it. This is going to be a really fun webinar because it's all about me. Because I tore my knee up playing pickleball because I'm an idiot and way too competitive and I'm diving for balls because God forbid I should let a 70-year-old beat me, right? And I tore my meniscus. So it's all about re-injury, preventing injury. So we're really excited today. We've got a great panel. We've got Keli Roberts, June Kahn, and Giovanni Roselli. I'm going to ask you please to go down to the green share button, go over to the chat box. I see a couple of you have already entered. Thank you, Jackie from Alabama, Luann from Iowa, and Morgan from South Carolina. Come on, I see Kat from Tampa. Please tell us where you're from. I love to do this. You have to know where the chat is because if you guys want free advice, like, hello, that's what I'm getting here on what we can do, this is a fantastic way for us to get it. So what I would like to do is I'm going to introduce our guests. Giovanni Roselli was recently voted SCW's Fitness 2020 August Livestream Mania Best Presenter. He's a highly sought after personal trainer. Is way down. Where are you again? Boca?
Delray.
Delray. Yeah. He's look at the background. I kind of hate him right now, but it's okay. And so he's in a very exclusive area. He's also a group fitness instructor. I don't know if you guys know this, but he's a master instructor for Institute of Motion, ViPR Pro. He also is an actor, and you've been on television before, right?
Yeah, I act like I know what I'm doing. So
He's lying. He's more famous than the three chicks that are in the room right now. Keli Roberts is the owner of Keli's Real Fitness. She's the recipient of the IDEA International Fitness Instructor of the Year Award. She got Best Female Presenter and Lifetime Achievement Award from OBOW, and she was inducted into the National Fitness Hall of Fame, which is really cool. And then June Kahn is the recipient of the 2009 World IDEA Fitness Instructor of the Year. She's a Pilates and rehab specialist and the owner of her own center, Your Body Pilates. It's an award-winning Pilates studio in Louisville, Colorado. And I'm just thrilled to have these people here. So we're just going to go. We're going right into it. Injuries are often caused by using too much weight, performing too many reps, hello, that we all do this, and using bad form. Hopefully nobody does that. And what we're going to discuss is how to design safe programs, effective exercise programs, and we want to find out programs that are beneficial to our high risk participants as well. And we know that both June and of course Keli, our active aging faculty trainer, know a lot about this. So what are the most common injuries seen by fitness professionals? Gio, what do you think are the most commonly seen injuries?
I think we can all probably agree on most of these. And when I teach the corrective exercise course, we go through this in depth. I have bad knees, I have a bad back, and I have a bad shoulder or neck, right? And those are the three big buckets. And when we think about those injuries, what I like to use my trainer brain with is if someone has a knee, something going on in the knee. Now you had like an acute injury, right? You were going skiing and or pickleball or whatever it was. But for the most part, when you look at a knee injury, what I try to initially do is look above and below the joint. And that's a simple like joint by joint approach that we call it, where it's what's going on in the ankle and what's going on in the hip. Because there's a good chance that whatever's going on in the ankle or the hip has affected the knee. And as we know, the body's one big chain reaction. Same thing with the back. If someone has some low back stuff, then there's a good chance that there's something going on in the hip or the glute and or the core that's maybe not working properly or not turning on properly. And now we have some low back pain or discomfort. And the shoulder, when you look at the shoulder, it's sometimes not the shoulder's fault. Look at the scapula. and everything that the scapula is supposed to do, protract, retract, abduct, adduct, and all, elevate, depress. And then you look at the thoracic spine. If the thoracic spine has the prerequisite mobility, then the shoulder has more freedom to move. So it's not necessarily looking at the specific site of pain could be the root cause of pain. I'm not saying that's always the case, but it's just something to think about and consider, and maybe start the discussion off like that.
So I really like your Gio is working exclusively with our corrective exercise certification. You've also doing the kettle weights, if I remember correctly. And not only is he an expert trainer, but he's very well versed in the corrective exercise. Now, whereas I think, June, you were mentioning you don't want to overstep your bounds as a fitness professional, but there are certain things, if we're working with high-risk patients that we, high-risk clients, never call them patients, that we need to be aware of. So June, we were chatting before we turned the camera on.
Well, I come from a Pilates rehab standpoint, so I get the majority of my referrals in my facility from physicians that actually send them to me, right? So I'm usually dealing with the client that has already been diagnosed and that is sent to me. And I think that's a really good point, because we're addressing, I'm sure we have personal trainers here on the call, and I'm sure we have group exercise instructors. So we have to take a look at both. And when Giovanni, I love what you said, because he's so right. You have to look at the structure. That's basically the whole gamut of that. But if a group fitness instructor, when somebody comes injured into their class, may not have the ability in the middle of the class to be able to do that. So in a group fitness atmosphere, when someone tells you, first of all, you don't know if somebody has an injury unless they tell you they have an injury. And when they tell you they have an injury, then we have to really just take their word at that point, what's going on, and then direct modifications and cues based on what we feel is going to be appropriate for them to move correctly. And if they still have an issue, then it's our job to refer them off to someone else. I don't think we can diagnose. When you're a personal trainer, it's a little bit different. You're working one-on-one, right? When you're working one-on-one, then you have the ability to really focus on form and alignment, because it is the structure of the body that really, because sometimes where someone has pain, that's not where the area of pain really is coming from. It's reflected to that point. So as Giovanni, you had said before, that if somebody has a pain in their back, I have shoulder, I had a knee replacement recently. Some of those injuries didn't just start with the exact area, and I had to really take a look at and had to go to someone to see where my structural deviations were, and then kind of work on that, and work on exercises, muscular exercises, right, that are going to be able to correct me in that form.
Modify it.
And modify it. Because before you go, I think every exercise that's out there, whatever we do in whatever form, can be modified. I don't think there's anything that can't be modified. And so I think everybody should be able to move, understanding what the base of each modification of each exercise is, and based on what the injury is, then we determine what the best approach is to give that individual.
And Keli works with a group. You've been working with a lot of active agers. Keli's been leading our active agers certification, oh my gosh, for quite some time now. And that seems to be also a huge group of your clients. And as people age, you get this fun, life experience, which means life injuries that you just accumulate over time. And how do you deal with that with your clients?
Well, for example, I started with a new client today, and she has spondylolisthesis in the lower back, a shoulder injury, knee injuries, and a neck injury. And so I start off with a very deeply involved health history form. And then I got her to show me what she was doing in physical therapy, so that I could see what the physical therapist was doing with her. And I haven't written her program yet, but she wants to sweat and she wants to work hard. And I explained to her, we're going to build from the ground up. You're not going to be able to, I can't go in there and kick you around the room. You're going to have to start foundationally and build from that, because I don't want to make anything worse. That's for sure. I want to try and help her build stability in her lower back and stability in her knees by developing some good mobility in her hips and thoracic spine and core.
It's emotionally difficult to get a client to do that. June, can you do me a favor? Can you try muting yourself? I just want to see if it's your computer that's making a little bit of the humming. And I don't think it is. Oh, yes, it is. Maybe it is. Anyway, we have to deal with these people emotionally as well. I mean, I'm sitting here and I tore my meniscus and I'm looking at a ski slope going, oh my, I just want to cry. And I'm like, no, Sarah, shift your brain. You can't even do a treadmill. You're going to do the elliptical because you're in a very safe range of motion that we're going through right now. So how do you emotionally guide that client, Keli?
Well, with a lot of compassion. I've been there myself. I had 3 shoulder surgeries, including a shoulder replacement on my left shoulder. I've had a shoulder surgery on my right shoulder as well. And it has been a process. It's been a real process. I had to learn to be compassionate with myself and find ways of satisfying that need to exercise maybe in other ways. I couldn't get on my bike for months after I had my shoulder replaced. So I walked. And I rehabbed my shoulder in the pool. So the water is a great place to go. Find alternatives.
That's wonderful. And Gio, what are your thoughts about, dealing with a client emotionally? You had some great suggestions earlier.
Well, I've been there as well, Keli, where I've had 5 shoulder dislocations. I've had 2 major shoulder operations. I've partially torn both of my pecs. I've torn my ACL, MCL, PCL in my right knee, had major ACL reconstructive surgery. I've broken my right foot, and I've had low back scares when I was wrestling full time at the time. So when it comes to compassion, I feel like it's like unfortunately unfortunate. When you get injured, you're much more empathetic and have more compassion for people that are injured. One thing I will say is, and I'm sure some of you have heard this, is that training the uninjured body part. So say you have an injured left shoulder and you say, well, I can't do upper body. But if your right shoulder and your right arm is okay, there's actually a good amount of research that supports to train the other arm. And there's actually up to a 20% carryover to the other side. If I just train my right arm, there's actually a 20% carryover to my left arm, even though my left arm is injured and it's not doing anything else. So keep that in mind too when we're looking at injuries and talking about injuries, is if your right leg, your right knee is injured or in pain, and obviously too, and I agree, keeping in our scope of practice, working with physical therapists, working with chiropractors, staying in our lane, there's no reason why you can't still train your left leg, left thigh, left hamstring, left calf, left ankle, and there will be a carryover there.
That's interesting. I know we're all talking about our injuries. How old are all of us, right? But everybody's had these injuries. And I agree. I think part of it is just giving empathy. Being a lawyer, I don't want to say, oh, I wonder if we overdid it in the personal training session I led you with, 3 days ago. You don't want to say that. You want to make sure everybody gets a doctor's release form before you get them on as a client. Make sure, I love, Keli, you mentioning the health history form. That is key. You need to put a little addendum at the end of the health history form that says, I agree that my trainer is only going to use this for this initial interview. Because, we can't remember everything with every client. And then third thing we want to make sure is get a good informed consent form. Because with the way the medical profession is now, and with the way things are going on in the government, we have no money for Medicare, Medicaid, and our insurance companies are being drained dry. We're not going to get physical therapy for 3 months, 6 months post post-injury. They're going to be sent to us. Like June, I think that's wonderful that you're hooked in to the Stedman Clinic and they're sending you people. And we're going to be sent people and we want to get these people, but we have to make sure that we embrace them correctly. So what modifications? I know, Keli, you said we've got to go from maybe this person wanted to be a runner and you've got to tell her you've got to walk. I walked for this long a time. It's great to rehab, the lower body and to also let the upper body, let's say, relax for a little bit. But what modifications can be made for clients with previous injuries that don't sacrifice intensity, that make them feel that endorphin rush? Yeah, you.
I think walking is always good. I'm a big fan of walking, and I'm a big fan of the water. It does depend on the injury. It depends on whether it's a lower body or upper body injury. With upper body injuries, you have a little bit more choice of what you can do with your legs. But, there's an initial period of weeks where you can't get your blood pressure up if it's been a major surgery like a joint replacement. And so you just they have to follow doctor's orders and get released from physical therapy. Once they're released from physical therapy, I speak to the physical therapist and make sure that I'm on target with what they've been doing. And one of my rules of thumb that I do is I get them to bring their physical therapy exercises on the sheet, and then I progress those movements and use those as the foundation to the direction that we're going to head for strengthening that area of the body. So I use the PT exercises then I progress those exercises from those regressions, and go from there.
Yeah, that's a great idea. June, how do you deal with the clients that are recommended to you from the clinic?
We create, they're recommended to us. They come with a background, so we know what their history is in terms of what the injury is, what the cause of the injury, what the doctor does not want them to do, what the treatment is for them to do. But to be honest, we get them usually after they're released from their physical therapist. So we work very closely with the therapist, just like how stated. And it's really, really wonderful that now the wellness community is embracing more of that now, which the exercise and medicine campaign is on vital, where the medical community is being a lot more support. We literally, and now that everything's gone virtual, it actually was a bit of a godsend for us this time, because I used to have to call on the phone to talk to them. Now we're right included in their health network, so we can actually talk to the physical therapist and get an idea of where they're going. And just like Keli said, we build on that based on what the injury is. When you're talking about intensity before, I so agree with Keli that it really does it's got to be based on the exercise and what the injury is. And then keeping them on a plan, because typically, once somebody finishes physical therapy, not everybody continues. I mean, this is a perfect segue into personal training. I think if you can create a liaison with physicians in your area, I have 2 OBGYNs that take classes from us, and we do all kinds of programs for them that kind of feeds clients to you. And we also learn. I go to her seminars, or the same with our physician. I had a knee replacement a year ago, and that wasn't fun. So finding an alternative. You made a comment before, Sara. How do you find that high? It's really hard to find that runner's high when you're incapable of using your joint. It's not easy. And if you love exercise, you want to find ways that are going to satisfy that need. And I really believe people need to move, because if they don't, depression's going to set in. So it's our job to find those ways that they can continue to move their body, that's going to make them feel good, right? And want them to keep coming back. So it's a combination of what we I don't want to use the word prescribe, because we should never prescribe, but what we come up with in terms of progressive programming that they're going to go into, that's going to make them feel good and give them a complete supportive community that's going to be with them and stick with them. I've gone as far as calling the husband and, seeing I want them to have a good support system at home to be able to do this. But we're in a unique environment, because we are one-on-one. It's a little bit different when it's a group fitness, right? So
yeah, anyway. We got a good question here from Lynn Lynn Perry Parker. She's a lawyer too. She's in her late 50s. She's a Zumba Gold instructor, and the only exercises other than walking that she does is she says, I'm struggling with how we can advise regarding benefits of exercise when experts such as the speakers have experienced severe injuries related to their exercise or sport. So, oh my gosh, I love your question, Lynn, but it's interesting. You're going to have movements, and there's risks and there's rewards from the movements. And it's not being an idiot and going out and playing pickleball in your running shoes with side to side court movement. I didn't wear my court shoes that day. Forgot them. Don't do stupid stuff. That's how I advise people. Gio, how do you answer Lynn's question? How do you espouse on the benefits of exercise when you're still talking about personal injuries you've had yourself?
Yeah, and that's a great question, Lynn. And I'll kind of piggyback off of what was just said too. One of the things that I'll add is that you can never go wrong with the basics. The basics, and a lot of the basics are actually used in physical therapy clinics too. Now, and I totally agree that we should be working with a physical therapist, and most of my clients are referral based too. So they walk in and they're ready to hand me those physical therapy sheets already, Kelly. I don't even have to ask for them. They're already walking, saying, this is what I've been doing. So to work with those professionals is absolutely necessary. Now, the basics of a dead bug, the basics of a bird dog, if you have a spinal injury, you'll probably be doing some type of dead bug type of exercise. If you have a spinal or shoulder injury, you'll probably be doing some type of quadrupedal position on all fours. So those basic fundamental patterns and movements and exercises are going to translate from physical therapy into into our settings as well. One thing I'll say to kind of piggyback off what I said previously is, this may be easier said than done, is find what's not injured. Just work really hard on finding sets, reps, and tempos to challenge that particular area or body part. Whether that's, hey, they have a lower body injury, so you could do a lot of upper body stuff, or they have a shoulder stuff, so you can do a lot of stuff on the other arm and then do legs, and find some type of strength, find some type of positive on their body. And then you may say, oh, well, I got a client who's this. There's something. Use your intelligence, use your professionalism, and find something that's positive in them, and then go to town on that, and try to get them the intensity up on there. The last thing I'll add is, if your clients and yourselves have the wherewithal, there is something called an AlterG, which is an anti-gravity treadmill, which is actually used in a lot of physical therapy clinics and clients, where you could do a search. There's an AlterG anti-gravity treadmill in more places than you would think. So if someone wants kind of to get back into running with a good physical therapist, they can get on an AlterG. They can take up to 70% of their body weight off of their body, and they can run, and they won't have the grounding and pounding. And that's actually been used to help reintroduce running back into someone's routine. And then like Kelly said, the water is always a great option too. So I just wanted to add in the AlterG and the water as well.
Yeah, the water is a great alternative, as you mentioned. I think we're getting it. Gio's a little frozen right now. Is that right? Oh, there we go. He's back. But I love that anti-gravity treadmill. I think that's extremely.
I think we lost her, huh?
There we go. Am I back? All right, let's hope if we didn't. Yes, Sarah's frozen. Yes. Am I back now? Yes. Okay. I love being in a condo. But Gio, I heard what you said. It's that treadmill. I'm able to do the treadmill because it's no lateral movement and it's fine for my meniscus. And then what I did is I thought, okay, what am I going to do? What else am I going to do? And I did upper body. I did biceps, triceps, chest, and back. And then I threw in some sit-ups. And I thought, and when I finished, I felt good. I got that high. I didn't have to get the same high that I get from skiing, being outside in the beautiful air or outside on a court, but I still was able to focus. So I think that's great, marvelous advice. So what do I do if my client sustains an injury during the training session? How do I deal with that? June, what would you do if one of your clients in your facility had an injury right then and there?
They require immediate attention, right? And then we have to assess really quickly as to whether there needs to be medical attention, right? So if it's somebody who I'm in a Pilates studio, say somebody fell on their knee, right? And the knee is bothering them. Well, not going to have her continue he or she have her continue exercise. I'm going to address that, get ice, recommend we better make sure we've had our waivers signed. As you said, that should be done prior to any injury anyway. You should have that on form then. And then depending on the severity of the exercise, some people will say, I'm fine, I'm going to continue. That's up to them. But if I feel that the injury is more severe than I think they think it is, I'm going to give my recommendation to say, maybe you should just stop for now and just have it checked. And let's wait 24 hours and see how things feel. And then refer them to a physician. It really depends. I mean, if they just cut their finger, I'm going to find a Band-Aid and help them. It really depends on what that injury is. I mean, because we can't diagnose. That's what we can't do. That's one thing we shouldn't do. That's when I think we put ourselves in trouble liability-wise more than anything. All we can do is give them a comfort, sit them aside, pay attention to them. Don't let them feel like they're lost. Maybe even have to escort them to the car. If you have to call an ambulance, you call an ambulance. You take whatever. Hopefully, everybody who's certified should be CPR, right? Should have some kind of area of expertise in how to be able to handle a minor injury. When it becomes major, that's when we need the medical professionals. Sarah, you're on mute.
Thank you, June. You're going to be leading this webinar. I muted because I was worried about my internet. Oh, dear Lord. Okay. An injury report form, guys. You need an injury report form. We use them at our MANIA conventions. The recording will be available tomorrow late afternoon. Mike Lieber is running this webinar. He's wonderful. He does our videos, and we will find that injury report form and we will include it not as a legal form, but as business advice for you guys to use, because people do stupid things. I mean, they really, Kelly's nodding. Kelly, you're going to have to unmute because they do stupid things. We had this person who was training for a marathon, ran like 20 miles in the morning, and then went into a Schwinn certification. Could you just die? All right. And what did they do? They fell off the bike. It's terrifying. Immediately we called 911 and we got him to the hospital. I'm a big proponent of, you know what? I'm not going to treat you. I'm not going to touch you. I'm not going to give you a Band-Aid, although we do give Band-Aids out. We don't give medications out at Manias. But what we'll do is we also will have immediately the staff that's right then and there fills out the injury form. Kelly, you were going to say people do stupid things.
People do stupid things. I had someone in my indoor cycling class get off the bike in a pair of look cleats, the plastic cleats, on a tiled floor to walk to the bathroom. Didn't take her shoes off, slipped and dislocated her knee. Just crazy. Injury report form, called an ambulance, put ice on it. And Giovanni, I think you're a brother from another mother, because I've broken 11 bones. I'm a competitive cyclist, so my shoulder injuries and injuries have come from falling off bikes not from overuse.
Let's hope the worst is behind us, and let's also hope that everyone listening to this doesn't think that we don't know how to take care of ourselves because we have so many injuries.
You know what?
Why should we be listening to these people? They're more
But-
interested in our clients.
So, I mean, go ahead, Sarah, go ahead.
Everyone on this call is a little bit nuts, okay? Because we're obsessed with fitness. It makes us feel so good. We love it. So we are obsessed. June, what were you going to say?
I kind of forgot. It kind of went in. I'm sorry. But I know what I was going to say that the reason we are here and we're in the position we're in is because movement does heal if it's done properly. So the human body is the most amazing thing. It's what probably drives those of us that are into extreme sports to do more, because we don't think about that. We think of that excitement that we get from it. But if we do get injured, look how many people make a comeback. I mean, I think that's, if we can't forget that the benefits of exercise far outweigh not exercising at all. So even if you're injured, movement is going to help heal you. And I think that's one thing we have to really let our clients know, that the benefits of movement go far beyond that. So anyway, that's what I was going to say.
And let me just piggyback on one
of
thing with that, June.
Okay.
Sorry, Sarah, there's two things that generally make us all feel better when it comes to movement: blood flow and exercise, circulation.
Yeah.
So if you can increase and improve or get blood flow, right? What do we hear the expression? Let's get the blood flowing, let's get moving, right? And then increasing circulation and getting oxygen through our body, by however means that is, then we're going to feel better, either consciously or subconsciously. So those are two things that I always think about too, is, okay, how can I improve blood flow and circulation in a particular session? And to go back to the injury question is too, that's where you have the chiropractors, the physical therapists in your pocket, and you have this network where you can say, I want you to go see my friend. I want you to go see my buddy tomorrow, because I'm sure we've all had it where someone's injured and I'm okay. I'm good. It happens. I'm fine. It'll be okay. Like June keeps saying, stay in our lane, and that's not our decision to make. So have a bunch of chiropractor and physical therapist friends, and if you don't have them, make them and send them to them to make sure they're okay.
And it's, you know what? People get injured who aren't in shape. And it is a much longer, tedious, painful recovery. I'm in shape and I'm sitting there going, okay, I'm going to get my meniscus surgery. The doctor said to me, it's 4 weeks recovery. He looked at me, goes, you'll be teaching in 2 weeks. You'll be fine, because I teach yoga. And he says, just, you're going to have to watch the flexion and extension. If you are healthy, your ability to recover and your ability to prevent injury is also better. And that's something we need to remember, and we need to reiterate to people. If I'm stronger, I have better balance, right, Kelly? And so there's certain things, certain exercises, and certain protocols we can do to maintain and prevent injury, like the balance training.
So true. And I think too, I always encourage, if someone is coming from a physical therapist, or their physical therapist has referred that client to me, I make sure that they've been doing their physical therapy exercises. I really encourage people to do the work after you've had a surgery, because if you're not willing to put in the time to do the rehabilitation exercise, you just don't bounce back as well. You really don't. I've seen both sides of that.
I have a quote for that. What gets us healthy keeps us healthy. Right? So, like, to Kelly's point, if these exercises are good for your injury, then maybe you should continue to do them even when you're feeling good, right? So then you won't, what's the other point of this webinar? To not re-injure yourself, right? So to do that, maybe you need to continue plugging in these exercises even when you're feeling great and feeling good, so you continue feeling great and feeling good. So sometimes what gets you healthy keeps you healthy.
Yeah, that's very true.
Oh, I love that saying.
Yeah.
I think it's fabulous, because what also is going to happen is a person who's injured who doesn't exercise regularly goes in, does the rehab on the shoulder, leaves, stops doing rehab, the muscles atrophy, the connective tissue gets drier and less elastic, and they're just right back again. And so we're the next step. It's not like you go into physical therapy and here's your little card, here's your bill of health. No, we're the next step to keep it going. Keli, how do you address the mental and emotional components of your clients' injuries?
I really love meditation. I think meditation and mindfulness is huge, because it is really stressful when you can't train the way you used to doing. And I think you've got to find some kind of balance internally and find the things that nurture your spirit, whether that's meditation or moving meditations like working in the garden, or not heavy gardening, but like little gardening or knitting. Things like that are really, I know it sounds really silly, but in 1998 I was diagnosed with a rare autoimmune disease, and I couldn't exercise for 6 months. And I discovered, I really couldn't do anything. I could barely walk around the block. I started from zero. And it was things like working in the garden. I took up knitting, I took up meditation, and that all nurtured my soul in a really meaningful way that got me through the emotional hardship of not being able to physically exercise.
Yeah, and I remember the knitting. I'm here in Colorado. I was wearing the black and white hat that you made me. I think it was a couple of years ago, actually. But it's good, and we need to embrace this. I think my meditation is Grey's Anatomy. I think 17 seasons of the same sitcom really working. Not sitcom, I guess it's a drama, who knows. So what professionals should I have in my network? Like June, I know you nurtured, you found the gynecologist, you found different physical therapists. How do you encourage the people that are on this webinar to find people to feed them clients?
Just reach out in the community. It's as simple as that. It was legwork of me reaching out to individuals, as well as your own network of professionals that you have. As you guys know, I'm a 2-time cancer survivor. So when as I was going through treatment, I actually spoke to my oncologist of what programs do you have that support exercise for cancer survivors. And at that time, this was 10 years ago, they didn't have them. So I actually was able to start something, but you have to reach out. I reached out to my OBGYN. She became a client to try the classes. That created a network there. And out of that came a program that we do that's all for pelvic floor because she had so many patients that needed some kind of help for strengthening their pelvic floor. So we were able to create a program for that, which really helped us do that. Secondly, I love, Giovanni, what you said before, align yourself with a chiropractor, align yourself with a neuromuscular specialist, find those people. You can find them in your community by simply joining your Chamber of Commerce. Join your Chamber of Commerce and you'll meet so many health professionals. And when you network that way, you can start to meet, let them know what you do, invite them in. And that's the best thing you can do, is reach out to a physician, a physical therapist, and invite them to a session. It's worth giving away a session to that individual to let them know what you do. Therefore, you start to create this network. And that's basically how we started. And there should be a crossover between medical and, I'm sorry, go ahead, I finished. Between the medical and a fitness professional.
No, you're right, the crossover. I was just going to say, I know that he gets a lot through referral. And how do you do that? How do you engage with that so that you can attract more clients?
Here's another cheesy quote that I'll say. You need to network to keep up your net worth, right? Because in the end, we're hopefully getting paid and making career out of this. So in the end, it still comes to making money. So that's where the networking comes in. And all I've tried to do throughout the years is literally, introduce myself, whether that's sending emails, sending direct messages, or literally, if a place was close enough, just walking in one day and just introducing myself. Always dressing the part, always maybe having a resume with me, always, always being fully prepared, to have a professional network. Because in the end, if they have half a brain, they'll know, wow, if this trainer will refer people to me, then I'll make more money. And then if he's good to me, I'll be good to him, and I'll send people to him, and then he'll make more money. And then in the end, everybody's happy. And this is still a bridge that we are trying to cross as, the two worlds collide, because before it was, oh, these trainers don't know anything, or, don't go to a doctor. But now we're realizing that we can work together and we can all do it very well.
That's great. Of course, these things go way too fast. We're like just about out of time. Keli, can you give us your closing remarks for how do we prevent injury and prevent re-injury?
I think the first thing you want to do is learn how the body functions, get educated, and continue your education. The more you know, the more you know you don't know. And so be curious and learn about how the body functions. So get certified and then continue your education, find mentors and learn, and then find a network of professionals that you can refer people to, like good physical therapists, chiropractors, and doctors.
Great advice. Thank you. June? Oh, June, you're muted.
There you go. Can you repeat the question, Mama? I'll make sure I address it the way you asked for. Sarah, could you repeat your question?
Sure. How do we train to prevent injury and re-injury?
Okay, so first of all, how do we train to prevent injury is to make sure that we're just not overdoing it. We want to make sure that, and I want to go back to Keli and piggyback to Keli, because that's what I was thinking in my head when she said it. Power comes from knowledge, and the more education that you have and you arm yourself with to understand what your area of expertise wants to be, right? Whether you're a personal trainer, or you're a group exercise instructor, whichever, I think that's important. And when referring that to injuries, we want to make sure that we're understanding the body to be able to advise someone on how to invoke an exercise that's proper for them. So.
Great advice. Thank you. And Gia, what would be your closing? Give me a quote. Uh-oh, you're muted. We're all muted.
I just gave you the best quote, but I'm not going to repeat it.
I already wrote it down.
But one thing I think needs to be said, it's often said, it hasn't been said yet, is just stay away from these circus tricks that we're seeing on social media. If we're seeing this, and oh, let me try that, or oh, that's cool, that's fresh. Like, stay away from the circus tricks. There's a reason why the basics are the basics and the fundamentals are the fundamentals and the foundational movements, which is why I said, a dead bug and a bird dog and a quadruped position, you really can't go wrong with the basics. Know your scope, which is something that we've all agreed on. Know your lane, and obviously, like Keli and June has said, know what you know what you don't know, and feel free to say, I don't know this. I better ask someone who does, or I better find someone who can help me, as opposed to, hey, let's do some lunges. Let's see what happens. Don't be that guy or girl.
Don't do that. I love that. All right, we are going to share with you a video to close with.
To begin, click on Attendee Access, located at...
I picked the wrong video. Let's try this one. Here we go, guys. guys can tell, we're having our Active Aging Summit. It's our first Active Aging Summit we've ever held. Gio is one of our presenters. June is presenting, and Keli Roberts, of course, is presenting. Thank you all for joining us tonight. I look forward to seeing you next week on Tuesday with another webinar, Tuesday, Thursday, and have a wonderful weekend. Bye, everyone.